We have been here before, and I am happy to acknowledge that we have been here before, but I've also said publicly that I'm not ashamed to change the location if I thought this was a better one, and I do indeed think this is a better location and indeed the best that we're going to get. It's got significant outside area. It's got, like I said, it's got a large floor space internally as well for clinical areas. So I think that this is the best area that we can have. It's centrally located with great disability access. There's a really nice garden area there. It was something that was felt to be really important by the clinicians and the staff of the community mental health facility. If someone comes in with acute needs, they can always be taken outside as well to calm them down. It has therapeutic values.
So from the pictures, you can see it's a completely different environment to what we have now at Coaling Island. It's a much more welcoming and inviting environment, and more of the social aspect to bring patients, service users together, multidisciplinary teams together in a very relaxed and again inviting environment.
As you can imagine, the refurbishment of the building is going to be quite expensive. So we have got a significant donation that's coming in for the refurbishment, and we've got a couple of other donations. This is a project which we see that Gibraltar is quite keen to assist on, but there will be a chunk that will be government funded. But we've got plans which are at REBA stage 2. So we still need to develop those plans. The plans need to go to town planning, and we need to work on the model of care separately.
We are developing a biopsychosocial model of care now for patients. So it's a wraparound service, very individualised to patients' needs. A lot of work has gone behind the scenes. We've set up working groups, and each senior management professional leads on each individual working group, and those working groups feed into the senior management team, and that's how we're developing and looking and road mapping the patient journey throughout mental health. We worked in conjunction with service users, with relatives and carers. We interviewed staff, and we also consulted with the World Health Organization recent paper published, which was 2024, that looks into that biopsychosocial model of care. So we're not just treating your mental health, we're looking at social aspects, so your housing, we're looking at education, we're looking at employment, and biological side. So how is your physical health?
What we will be seeing is a whole new service that's been provided from this new building. So it's about having a central point of access, a single point of access for anyone with mental health issues. We are also locating the Citizens Advice Bureau and the Ombudsman's Office in the same location, so that these people that require mental health services sometimes can have issues that can be related to the Citizens Advice Bureau. We also have a housing outreach team within the facility. So the idea is to have a single point of access where people with all sorts of issues can attend. It's trying to catch issues before they get to an acute stage, so that they don't progress to an acute stage, so that people feel that they are supported within the central community. So it's a whole new outlook on mental health.